Well, tonight in Melbourne, residents are in their second week of lockdown with the possibility restrictions may be eased on Friday. 2 more local cases were recorded today and importantly, authorities have been able to link the mysterious Delta strain to hotel quarantine.
Yeah, and after a slow start, there's now a concerted push to get as many people vaccinated as soon as possible. All Aboriginal and Torres Strait Islander people aged between 16 to 49 are now eligible for the COVID-19 vaccine.
That's right. And earlier we spoke to Dawn Casey, the Deputy CEO of NACCHO, the National Aboriginal Controlled Community Health Organisation, which is overseeing the rollout in Aboriginal health centres. We began by asking her just how many Aboriginal and Torres Strait Islander people have been vaccinated so far.
Yeah, there's just over 65,000 Aboriginal and Torres Strait Islanders who've been vaccinated with their first dose so far. So that's looking very good from our perspective. And, you know, we're joined in the rollout, by the way, by the Federal Department of Health.
Are you happy with the pace of the rollout, or are you concerned that, you know, it's not fast enough? Is 65,000 fast enough? And if it's not, are there any states that you're particularly worried about?
Well, I think what happened, we were doing extremely well. The ACCHOs around the country were doing extremely well. And then the issue was AstraZeneca was found not to be suitable for those people under 50. So I think there's no doubt that the rollout has been slowed down because of that fact, and the availability of Pfizer, which is now available and has started. It's commenced in Melbourne. There's been a good spread across the country with the Pfizer vaccination. Melbourne, you know, Gippsland, Warrnambool, Darwin, the Kimberley, Brisbane, and a number of places elsewhere across the country. So that's starting to pick up now, which is really promising. And the area that is a little behind the rest of the Australian population has been the under 14-9s, the Pfizer vaccination for Aboriginal and Torres Strait Islander people. This just demonstrates that where ACCHOs are involved in the rollout of vaccine, we have a good roll-up, people that feel culturally safe, and the Commonwealth in the next couple of weeks will roll out the Pfizer vaccine to a number of ACCHOs around the country.
And it sounds like you just mentioned about some suitability concerns about the different kinds of vaccines. Dawn, is there any concerns or hesitancy in community at the moment, and what work is doing to make sure that we're countering that?
Okay, so I definitely think there was huge hesitancy when the announcements around the issues that AstraZeneca was not suitable for under 50s. So there was definitely hesitancy around that, and people see all the media. In the last couple of weeks, though, the numbers have started to pick up, and I think that's most probably because of the issues of COVID being now out and about a little bit in Melbourne and particularly Victoria overall. So they have started the Pfizer vaccination with the help of the state government and through ACCHO, so that's been good. We would encourage, there's been no blood clots for Aboriginal and Torres Strait Islander people recorded for those over 50. And the numbers for over 50 are in line with the broader Australian population. So we do need to do catch up with Pfizer, and the Commonwealth is starting to roll that out in a couple of weeks. We've in fact surveyed our community controlled health services last night, and 48 out of the 107 have come back and said they're available to roll out the Pfizer. Just
on your message there to the over 50s and over 16s, of course, the vaccine is now open to all Aboriginal and Torres Strait Islander people over 16. I'm going to get the message, I'm going to get the vaccine, tomorrow in Canberra. But is there a lot of hesitancy with over 16s? And if so, what's your message to those over 16s to get the vaccine?
I strongly encourage you to get it because whilst there's sort of evidence to suggest that it doesn't have a significant impact on those younger people, but there are a large percentage of our population who have comorbidities, who have chronic diseases, our younger population, much more than the wider population. And also, if you, even with the COVID vaccination, you can still have contract COVID. So it's important to keep all of our elders safe. So everyone over 16 needs to have the vaccination.
How do you feel about supply issues?
Yeah.
Will there be any? Are you expecting any? And what's being done to kind of counteract that?
Well, Pfizer is available in some community controlled health services, but more and more from 1 July, the Pfizer will be available for community controlled health services. So I urge people to make their bookings and start to access the Pfizer vaccination. And all of those over 50, please go in and have your AstraZeneca. That's available now in large quantities. So go ahead and, if you have any concerns, just contact us and we'll make sure that we identify a place close to where you live.
This week we saw Darwin's largest Aboriginal community-controlled health service, Danila Dilba, say that it's been forced to turn people away in the middle of this pandemic because of a funding issue. What's your reaction to this?
They're seeking extra funding from the Commonwealth Government they service a large number of the population who come in from remote communities. And they do, extraordinary work in terms of emergency care. I suspect they also need to approach the Northern Territory Government because they do undertake much of their work that would normally happen in hospitals. So they're stating that they have a huge issue. But that doesn't stop people from going along to their clinics and for their COVID vaccinations. I understand there is some hesitancy around Darwin. There has been some hesitancy in the bottom end of Western Australia, so we're strongly encouraging people to go forward with it. There's been to date, no clotting for our Aboriginal and Torres Strait Islander people who've had the COVID vaccination, the AstraZeneca vaccination. So please go ahead and make your appointments, talk with health practitioners and health workers and nurses, and line up and I urge you to have your vaccination. I've had mine, due for my second one soon.